The third area I discuss with my patients is social and community well-being. Firstly, let's discuss your relationship with your partner. This is very important for two reasons. One, it's important for you both. Whether or not you continue to have a baby, it's so important for both your physical and mental health to have a good relationship. And two, your relationship will be your baby's whole world. So it's so wonderful to create this secure, loving, kind relationship that will reflect a kind world to your child. If you're concerned about domestic violence, preconception counselling is a great time and a very important time to raise this and to get the help you need. There are many resources and services available to you to keep you safe. Another topic that I like to discuss with couples is equal sharing of household responsibilities. Usually I have a fun exercise to do with couples where I've got a list of around 20 chores that are normal around every home. And usually I get the male partner to write down the name of the person who does this chore around the house. Usually they realize that 90% of the work around the house is done by the female partner. And this is a very important insight because when the woman gets pregnant or when she's breastfeeding or postpartum, her workload increases by 200%. And it's very normal for women to feel burnt out and to feel exhausted. So it's very important to have that insight beforehand in order for their partner to lean in and in order for the partner to make sure that they invest in their relationship to prevent burnout and to keep them connected. In order to illustrate this, let's go through a case study from one of my patients. Layla presented with her husband to preconception counselling, and I asked him to go through the list and to put the names of the person who does the chores around the house. Layla's husband works very long hours, and she's a stay-at-home wife. She's always been raised to care for others and to be incredibly responsible and reliable. She naturally does everything around the home, from cooking, caring for their extended families, cleaning, gardening, and she even replies to emails for him. We reflected on how some couples I've seen in clinic who have a similar pattern to Layla haven't had sex in 18 months and have had such a strain in their relationship and have so much stress in their relationship because the woman's workload postpartum has increased by 200%. Women feel exhausted and resentful and their libido completely vanishes. We spoke about how that's a risk factor for marriage breakdown and happiness breakdown. So my heart was so happy when in subsequent reviews with Layla, she told me about how her husband has been making a huge effort to help with cooking and cleaning and how he's been really wanting to learn how to help her with these things pre-having a baby so that he can continue to support her and take the load off her after having a baby. During preconception counselling, we also talk about the idea of a village. It truly takes a village to raise a child. Khalid Gibran talks about how your child doesn't belong to you. They belong to themselves. They're their own separate individual. And they exist and they thrive in a community. It's very important to have a community around them, a community who supports you and them. It truly takes a village to raise a child. And this is not only true for the first 6 weeks, but for the entire life of the child. Postpartum depression peaks in the first 3 years after a child's birth, so it's important for people around you to lean in for the whole time. You should nurture your relationships with the people around you, including your parents, your partner's parents, aunties, uncles, adopted uncles and aunties, mothers groups, other daycare families, babysitters, and everyone around you who can support. Dana Raphael, a very influential anthropologist, talks about the breakdown in our society of support for mothers. Mothers need extensive support from their partners, parents, siblings, friends, and other mothers. It's impossible to do motherhood alone. We really need others to lean in and provide that support. One of the last elements we discuss in preconception counselling is legal, financial, and other elements that you need to consider. You should research your work leave. You should see what you're entitled to in terms of parental leave and for how long. You should do a budget, see a financial planner if you need to. You should decide whether you're using your private health insurance or whether you're going through the public system. You should think about cloth nappies or elimination communication or baby leg weaning. You should decide what Instagram accounts you want to follow and what books you want to read. You should research all the equipment that you need to buy and car seat safety and pram safety and all of these wonderful, exciting topics. This is a wonderful time of transition. Congratulations on embarking on this next life stage, and I hope it's filled with joy and growth for both of you.